Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullahi wa barakatuh. Let me first introduce myself. I am Dr. Wahab Saab. I'm professor of surgery and surgical oncology in Egypt. I'm an Egyptian in medical school called Qasr Al-Aini Medical School. Now I'm settled in Saudi Arabia and I have a job in Saudi Arabia, which is perfect. Living in Saudi Arabia is perfect. The system is wonderful and the payment is good as well. For the time being, I'm handling a position, one of the biggest private hospitals in Saudi Arabia called Saudi Government Hospital. I'm the head of the surgery department and deputy of the CMO for the whole surgical division. I went through a lot of exams across the world. I'm telling you, the Saudi Commission exam, one of the most stressful exams. But in the meantime, it's one of the most easy exams to pass. And this is our core purpose in this course, to make it easy for you to pass. It's so easy to pass it. I'm living in Saudi Arabia for the past 2 years, and I didn't regret to have this transformation or career path. So hopefully, if you are willing to do the same, we will be here to help you on this. I went through a lot of exams in different countries, and I'm telling you, it's so easy to pass this exam if you have the structure. So welcome you all among Prep Medical Group for the Saudi Commission exam preparation. It's an honor to introduce our faculty. We have a very prestigious faculty in this course. I'm telling you, you will be very, very, very surprised and very pleased by the material and the course that we will give to you and the structure that we will try to put you on it to make it so easy for you to pass the exam. I'll ask the faculty to introduce themselves. I'll start with our Professor Dr. Adel, one of the most eminent and senior consultant in Saudi Arabia. He's a trauma and general surgery consultant. So Dr. Adel, please.
Good evening, everybody. My name is Adel Mahjoub. I'm a consultant general laparoscopic surgeon. I'm one of the old boys who did their fellowship in 1991. And then I finished my 7 years high surgical training in UK. My main interest is actually trauma. I'm currently a senior ATLS instructor and a course director. I'm also senior instructor in ATLS, so teaching is part of my interest. I fully agree with Dr. Wahab that what we are going to provide you in this course is we're just going to get your footsteps more solid to walk through this exam. We might not be able to give you far more knowledge, but we'll be able to give you the path through which you can easily pass through this exam. And I'm sure Dr. Haifa and Dr. Faisal will give you the same comments.
Thank you so much, Dr. Adel. It's an honor to have you among the group. I believe you will enjoy the lecture and the Bible sessions, Dr. Adel, a lot. I'll tell you something. To pass this exam, it's all, as I stated in the beginning of the session, it's very easy. But one of the most critical challenges that I faced myself when I was preparing myself to that exam, I didn't find anyone to tell what I'm going to do, any structured material or any course. And we are honored to be the first group across the Gulf area to give this course to the candidate. It's also for the, if you are interested to work in Dubai or Abu Dhabi, it's the same. We have the same module. So our second faculty here, which I'm personally honored to work with her, Dr. Haifa Al-Ataibi. Dr. Haifa, she's the most famous one in the Saudi Commission exam. I'll tell you why she's the most famous one, because the book that all of us study that book to get in the exam and pass it, it was written by Dr. Haifa, which is a case study book. I believe all of you, if you are preparing to do that exam, you will be familiar with it. So, Dr. Haifa.
Thank you, Dr. for this nice introduction. I'm Dr. Haifa Al-Ataibi. I'm a graduate from Saudi board myself. I did 2 years of surgical in Canada, and currently I'm doing breast oncoplastic fellowship in the UK. I think my goals and purpose align with the group of prep medical, because the story behind my book, when I was preparing for my exam, there was no source for to study from. So I was told to make that source, and I hope I did. And I joined the group at Prep Medical, and our goal, as Prof. Adil mentioned, is to fill the gap between clinical knowledge and excellence. We know that you have the basic knowledge to pass the exam, and our aim here is to guide you how to use that knowledge and present yourself as a future consultant and pass this exam successfully.
Thank you so much, Dr. Haifa. Again and again and again, it will be a great honor and a pleasure to work with you again in this course, helping our colleague candidate to pass the exam. Again, Dr. Haifa, she's the writer of the book that we used, all of us used it to pass the exam. It's a very brilliant book. And I believe you need to have a source of this book, and we'll give you the link to have a copy of it. And we'll try to go through, after permission of Dr. Haifa, of course, to go through the book, teaching you a lot of tips and tricks. Dr. Haifa herself will give you about 15 minutes today about tips and tricks to pass the exam. So our next faculty, my friend and my colleague, Dr. Faisal, please. Kindly introduce yourself.
Dr. Faisal Shekdour, Consultant General Surgery, Saudi Arabia, former assistant professor in University of Algiers, Algeria, oncologic surgeon. I'm so proud to be one of the most prestigious experts in teaching. Honored to be the first group teaching, making life easier for surgeons, for all those who want to work in Saudi Arabia and in Gulf. Believe us, through our experiences, you will see by the end of your training, inshallah, a big difference in your level, your self-confidence. As we said, because in the last webinar, 3 key points: have a good English level to listen and speak, had good knowledge, but the most important is to have good training. And this is what we offer. And through extensive training through all the stations, covering most of the topics of the exams, based on what is currently done in your exams, we will guarantee a success for all of you, inshallah.
Thank you so much, Dr. Faisal.
Thank you.
Then we will move to Dr. Mahmoud Talat, one of our eminent prestigious candidates as well. Kindly introduce yourself, Dr. Talat. Okay, I believe he has some connection issues, so we'll move to, actually, we are pleased to announce that our faculty is 7 faculty. All of them are very, very expert in the tip and tricks of the exam. And as I told you in the beginning of this session, we are the only consolidated course and program preparing candidate to have this exam at very easy process. Now we are going to Mr. Mani. Mr. Mani, he's the founder and the creators of the Prep Medical Group. He will introduce himself kindly, then he will give us a few statements about the Prep Medical as a whole. Then we will take you to Dr. Haifa tips and tricks of the how to pass the exam. Mr. Mani, please.
Yeah, thank you, Ihab, and thank you very much for running this show. You and Faisal have worked so much on the background in putting this together for the benefit of the candidates appearing for the Saudi Council exam. So to introduce myself, I am Dr. Manikandan Kathavela. I'm a consultant HPV transplant surgeon working in the NHS London. I work at the Royal Free and the Whittington Hospital. And I am the founder of Prep Medical. When I say I am, basically it's a team of surgeons in the UK. We started Prep Medical 3 years back. Again, based on various experiences we had in preparing for the FRCS exams, we started this group called the Prep Medical, which has now evolved into one of the top edutech firm in the UK delivering FRCS general surgery, FRCS ophthalmology, FRCS vascular surgery courses. Along with our FRCS programs, we started mentoring candidates for the Saudi Council exams, because the Saudi Council consultant interview exam is exactly similar to the pattern of the FRCS exams. I would say FRCS exam is quite very tough, but still the way the exam is conducted, the evidence-based approach, as well as the communication skill, whatever is expected in the FRCS exam is same as what is being assessed in your Saudi general surgery interview exams as well. So that is how we ventured into SCFHS platform. It's been 2 years since we started mentoring candidates for the Saudi Council general surgery interview program. We were doing it as one-to-one camp basis, and we had mentored close to, I would say, 10 to 12 candidates individually as one-to-one, and almost everyone succeeded in their exam. And eventually we thought, through our colleagues from Saudi Arabia, we had a discussion, and we thought, we were told that there is no structured program which preferentially guides the candidates who are appearing for this exam. That's how the whole thought process of bringing in a course came in. It was maybe 6 months back. We all sat together with 3 faculty to start with. Eventually we have now 8 to 9 faculty, all from leading Saudi trust hospitals, as well as people who are involved directly in the interview process, as well as in making questions for this exam. So we came together and we designed an course which is more of a candidate friendly course, I would say. So we sat and discussed what are all the weak points the candidates appearing for this exam would have, and the top priority was the communication and the language barriers majority of the candidates have. So we put that as the priority. And the second one, what we thought, was the extensive syllabus. If you see the syllabus you needed for this exam, it's quite very extensive. So we thought giving everything over a period of an intense 1 week is not going to work. So we thought we will split the whole syllabus over a period of 5 to 6 weeks. So we make a schedule for you. You just come in and follow what we are doing. And we have tested our work in our first course. If I'm not wrong, I think 4 of the candidates who gave the exams, they cleared comfortably, and they're very happy as well. And 2 of them are giving their exams. So this was our approach in our first course, and we are doing the same with the second course. In fact, we are adding something to it. So in the last course, we were just doing Viva practices, but this time, along with Viva, we are also doing lectures where you just come in, listen to whatever is needed in that particular topic. Again, we have categorized into subheadings, and you just need to come, listen, and get what is required, rather than going blindly and going through books, listening to colleagues and learning a lot, not knowing where you go. Again, on the top of it, we also have our own the app or the learning management system, where everything, even if you are unable to participate in a session, all the sessions are recorded, and it is available with you throughout your course. At the moment, we are offering for 3 months, but we are also having an option to keep it for 1 year as well, which will be keeping on updated constantly. So this is what we have, and our formula had worked so far, and we are hoping that we will be introducing more and more add-ons to the existing course, like how we matured ourselves in the FRCS course in the UK, even in the SCFHS. Okay, so this is the brief introduction from my side, and I wish all the very best to all the candidates here and the faculty members here as well. Thank you, Ihab.
Thank you so much, man. I believe you said everything, which is
really
perfect. Yeah. So in our faculty, we have another 2 faculties, which is Dr. Basim Sharif. He's the director of the Saudi board in the West region, and he's an examiner in the Saudi Commission. He wasn't able to join us today. And we have Dr. Turki. Actually, he's a consultant, Saudi consultant of colorectal, and he's an examiner as well in the Saudi Commission and the board examination. Also, as I said 3 minutes ago, we have Dr. Talat, but he wasn't able to join and introduce himself because of the bad connection. Now we will go directly to the tips and the tricks. We will enjoy all together the tips and tricks how to pass the exam by Dr. Haifa Al-Utaibi. It will take all of us rapidly through the the circumstances and the environment of the exam. Dr. Haifa, it will be a very short presentation within 15 minutes. She will tell you everything about what you need to do to know about the exam. Dr. Haifa, please go ahead.
Thank you, Dr. Ihab.
With you, Dr. Ihab. Good afternoon, all.
Just
Okay,
bear
Dr. Haifa. Yeah. Go ahead, please. Yeah. Dr. Haifa, I cannot hear you. Can you hear Dr. Haifa? Dr. Haifa?
Yeah. Do you see the presentation in the?
Yeah. It's clear now, and we can see the presentation. Yeah, please.
Okay. So I would like to start with thank you all for being here today. This session is designed to help you approach the consultant oral interview exam with confidence, clarity, and strategy. We will go beyond knowledge and we will focus on real-world tips from how to prepare mentally and how to present yourself as a future consultant and how to handle challenging questions calmly and professionally. Whether your exam is next month or next year, the goal is to equip you with practical tools to succeed. We will talk about understanding the exam format and how to prepare and some performance tips to apply in the exam and a final day mindset. It's a simple equation. Confidence comes from preparation and rehearsal. And when we say preparation, it starts by understanding the exam format. So the clinical consultant Saudi exam is a clinical scenario-based question. So you will be given a scenario and they will ask you how to approach this patient. And when you ask for investigation, you will be given results and how to apply this information that you know on the patient diagnosis. And if you need further investigation, they will ask you what are you going to do next, and then management. And the aim from all of this scenario is to assess your decision making, your prioritization, your judgment, and your communication. The question may include cases about emergency management, elective case planning, intraoperative decision, and postoperative complications. You may be also given a case to deal with a difficult patient, or how to obtain an informed consent, or to disclose either bad news or a medical error. Some cases that need some referrals, so they will test you and your knowledge on the referral system in Saudi. If it's an oncology case, they want you to approach that case through multidisciplinary care. So when preparing for the exam, try to master clinical scenarios. And when we say this, we say topics in clinical surgery, and common is common. Make sure that you master management of complex and common surgical cases like acute abdomen, GI bleeding, hernias, colorectal cancer, biliary disease, of course, trauma and ATLS approach. You're not going to be asked about the advanced in surgical oncology, but definitely you will be asked about basic surgical oncology, especially in common cancers like breast, colon, thyroid, HPV malignancies. You might be also asked about perioperative care, so prepare about prophylaxis, antibiotic, VTE prophylaxis, how to manage disturbance in electrolyte and fluids. In terms of decision making, they will assess your knowledge, indication for surgery versus conservative management, when to take patient for operating theater, and when to observe and try conservative management. Sometimes those patient needs to be referred to another specialty, or within general surgery, you need to refer them for further specialized person. So they want to know that you know when to. Preoperative optimization, making sure your patient is fit for surgery, handling intraoperative complication, or applying postoperative enhanced recovery after surgical protocols. When you're preparing, I advise you to go through this website. You will have ERAS protocol and guidelines for multiple specialty like pediatric, breast, colorectal, and cytoreductive is a topic they're working on now. Professionalism and ethics, you might be asked questions not related to the general surgical clinical topics themselves, but they want to assess your communication with the team, with the patients, how to manage medical errors, end-of-life care. They may touch also on cultural sensitivity, Islamic medical ethics, and so on. When preparing for those kind of oral exam, make sure that you have a structured response. So when you hear the question, your first priority is to establish a diagnosis, and always keep in mind other factors that, in addition to the diagnosis, that affect your decision of management, like patient age and comorbidities. When listening to the answers from the examiner for your question, always think, does this patient stable? Does this patient need immediate management? If the diagnosis is still not clear after obtaining all the clinical information, think about conducting further investigation. If you reach a diagnosis and it's time for definitive care, they will ask about this and some of the case scenarios that need further follow-up. Usually there is a twist point in those cases, so the case will start as the regular case, but then at some point, either during follow-ups or during the surgery itself, there will be an incident that twists the scenario, so be aware of this. Stay structured and safe. Always consider stabilization of your patient first, escalation when needed. Stick to the guideline and the management protocols. Make sure that you communicate with team, you ask for help if needed, you consult a senior colleague if needed, documentations, and all of this. Make sure that when you answer those questions, you speak a consultant level language. Use terms like, I would escalate appropriately, or according to the guideline, I will manage this patient with this and that. As part of multidisciplinary team, I think this patient will need to go for surgery first, or I will refer this patient for medical oncology for chemotherapy first, and so on. Avoid sounding like a trainee. Use confident, mature, and team-oriented language. When handling uncertainty, or if you are not sure about the answer, say, I'm not certain, but in this situation, I would consult the relevant guidelines, or I will discuss the case with other colleague or other teams to ensure patient safety. And always remember, a safe, honest, reflective candidates are more respected than overconfident one. Be concise when you answer, and answer only the question. Try not to elaborate more or give options if you're not asked to, because you're going to be giving a scenario. If the patient is unstable with this disease, the management is to take the patient, for example, to theater. Don't give option. If the patient is stable, I will do this. If the patient is unstable, I will do that. They want to make sure that you understand the question and you're acting accordingly. If you are running out of time, try to wrap up and say, for example, in summary, my focus would be on my patient safety, on the communication with the team, or to apply this evidence-based care to this patient. Practice, practice, practice. I cannot stress enough on practicing. Use checklist. And I think the benefit of checklist comes into 2 points. First of all, it organizes your thought and it makes you systematic. And the second point, there are too many teeny tiny details that you do them by default every day, but when you're asked about them in an exam, you forget about them and you focus on the main thing. So checklists help you become aware of this and organize your thought. Even if you're busy, do a 10-minute mock question and answer each day. Try to do 1 clinical case or 1 professional ethic question per day. This is an example of checklist. You can find them online everywhere. If you use my book for preparation, you will find 1 checklist in each chapter. You can use them while preparation. You're applying for a consultant job in Saudi, so familiarize yourself with the system, with the Vision 2030, especially the goals of healthcare transformation, Be familiarized with regional healthcare cluster structure, Central, Eastern, Western clusters, and have knowledge about the digital health, the telemedicine, the value-based care. You will come across cases that need referrals, especially if you're applying for a consultant job in the periphery. So be familiar with the referral pathways, primary, secondary, and tertiary care. Always consider Islamic values and local cultural sensitivities when answering questions, especially when it comes to sensitive topics like end-of-life care, female patient management. For example, having a breast cancer patient who is pregnant in early pregnancy. We know that the guideline says termination of pregnancy is one option, but when it comes to those sensitive topics, always consider the Islamic values and the cultural sensitivity when answering those questions. In terms of, for example, informed consent and family involvement, in the Saudi culture, family is pretty much involved in every single step of their beloved one's management. So always ask your patient, do you want me to involve your family in the decision? Do you want me to tell them about your disease or like about your surgery? Most of the time they will say, yeah, speak with my family. Their decision is my decision. So always consider all of this in dealing with those patients. If you're giving a chance to a final word, say something like, I appreciate the opportunity for the interview. I'm committed to provide excellent surgical care, and I'm looking forward to work with the team here. Always leave them with the impression of mature, collaborative, safe future consultant. On a final day mindset, sleep well the night before, do light reading or mock question and answer on that day. Think of the panel as colleagues, not examiners. And stay composed. If you don't know the answer, describe how would you find out or escalate or consult a colleague or a senior specialized person. Be yourself. The interview also assists if you're a good team fit. Avoid common mistake like speaking too fast. When you were asked a question, pause for 1 to 2 seconds, think before answering. Avoid over-explaining irrelevant details or giving like too many options or choices. Avoid arguing with the panel or getting defensive when challenged. We know that all of us, we study from textbook, but when applying this knowledge to oral exam scenario, try not to sound like you memorize the textbook and you answer without insight, and don't interrupt or assume. All of this will give bad impression and may affect your chance of succeeding the exam. And in conclusion, passing consultant oral exam is not just about knowledge, it's about demonstrating maturity, leadership, and safe surgical judgment. So again, practice structured answers, speak with clarity and purpose, reflect confidence, always stay grounded in patient safety and professional ethics. And thank you and good luck.
Thank you so much, Haifa. It was a brilliant one. I wish to have such a presentation before my exam, but I hope that all the candidates and the attendees enjoyed the presentation of Dr. Haifa. Again, Dr. Haifa, we all are honored to have her participation in our group with reference to her book that we all used while we were preparing to the exam. Now we will come to the feedback about our last course that we give it to our colleague from the candidate who were preparing to have the exam. This feedback will be given by my friend, Dr. Faisal. Dr. Faisal, please.
Thank you.
Give us idea about the importance of having the exam to be licensed officially to work in Saudi Arabia, and what was the success rate of our group last course.
I will go through a few points. First of all, our feedback about our last candidates was published regularly on our main group WhatsApp of Prep Medico SCFHS. So, alhamdulillah, all our candidates have an excellent feedback. All of them, they are very satisfied about the level they attend, about the level of training, about the quality of training, the quality of preparation, and where they were and what did they achieve. Second point, alhamdulillah, all our candidates who passed the exam take their exam, they success rate. And one of our best candidates, after arriving from Algeria, he passed examined after 6 weeks from arriving to Saudi Arabia. After first preparation with all our panel of experts, with effort following all the guidelines, he go through the exam and he is success from the first attempt, which is excellent. If you have background, French background, and you don't have much guidance and keyword and how to prepare, how to answer the questions, usually it takes 6 months. Usually it takes 6, maybe until 8 months to prepare thoroughly all the program and how to prepare this exam. But our friend did it in 6 weeks, and his video, I think, is already shared in the social media. You can find it. Third thing, what we appreciate as faculty, the level of our candidates regarding the communication, their knowledge, the treatment of the information as consultants, without going through the details, thinking as a consultant, answering as a consultant, as someone responsible, give the most important answer in the most short time, which is very important. Why I'm insisting about that? This is one of the key of the exam. If we will give it mathematically, the exam, in fact, it is 2 sessions of 30 minutes. In each session, you will have almost between 4 to 6 clinical cases. Each clinical case have almost 5 questions. So almost you will have 1, maximum 2 minutes by question. So within 2 minutes, you will have the question. So you need to have data. You need to understand what the examiner is talking about, and you need to answer very fast and give the right answer and the keywords. So to achieve this level, it's not just about having knowledge. You have, all of you, the knowledge, 100%. You are all of you surgeons, 100%. The English is not really a big problem, because when you train, when you practice, it will come. But the key training of your exam is the key to success. And this is very important. And this is what this course offers. By going station by station, each station, for example, Dr. Ihab had presented an excellent session in the upper GI during 4 hours. The candidates enjoyed his session because we have seen an excellent feedbacks in the group, and he goes through most all the program, most of the clinical cases, and you feel the candidate in the next session how is comfortable in talking, comfortable in discussing, and station by station, by the end, you will pass mock viva exam, which is simulation for exam of 1 hour with 15-minute feedback. You will see the difference between now and after training course. The other point, what we add in this second session, the lecture. These lectures will give summaries about the keywords of the most important topics before each viva, which will make the revision much, much easier. So 2 in 1, you will revise, you will have the most important points, and you will train. And you will be fully prepared for the exam. Also, the LMS, our library, it's excellent, open, available, 24 hours by 7, with the technical support. For me, it's a treasure. I used it before in my training, and it helped me a lot. Whenever you need information, whenever you need some details, you will go just through the videos, your videos or your previous videos, and you will find all the results that you will maybe need weeks and weeks to find. Because in fact, this is the idea. Have an expert of panels. They will summarize all the life for you and make things easier. And as I told you, for our friend who successed his exam during 6 weeks of preparation, this is, I think, pure proof to get through this training and get this exam and get this opportunity. And the last point, as you know, Nas, the policy is changed. Before we take interview in our countries, or for example, for North Africa, in Tunisia, in Egypt, then you can come here to Saudi Arabia, work, and prepare your exam. Now, the update is you need to have your exam in your country before passing even the interview. We are not achieving the point of having the contract of work. So it is a good point because it is restless, and it's good point because you will have 1 point plus in your CV. It is a hard exam, but life will be very, very easier here with our group. Thank you.
Thanks so much, Dr. Faisal, for the feedback. I believe we have two of our eminent, prestigious candidates just join us. So I'll ask them to introduce themselves. Dr. Basim Sharif, our professor from the University of Al Dr. Basim, can you kindly introduce yourself and tell the candidate and the attendees about our course and how you are going to help them? Dr. Basim.
Hi. Assalamu alaikum wa rahmatullahi wa barakatuh. It's an honor and pleasure to meet you. I'm so sorry for catching up late. I just had a patient in the clinic, so I apologize. Honestly, like I just joined the group recently, and I can feel the energy, I can feel the excitement, the enthusiasm in everybody in the group about you guys as a candidate. I had the honor to do one mock interview with a previous candidate, and I could feel from his feedback how like he enjoyed the session. It's yes, it is only mock interview, but I hope with the experience everybody in the group have it or had this experience to enable you guys. I just tell you about myself, and I'm sure you know the other very well. I'm a consultant surgeon. I'm assistant professor at University, and I'm as well examiner in the Saudi Commission for Health Specialties, and I'm a program director for general surgery in the Saudi General Hospital and the Western region. I did my training in Canada, my residency and fellowship, and I did part of residency before I got to Canada here in Saudi Arabia. There is so much like transformation of training of exams in the Saudi Commission, and like it's becoming a little bit more difficult, but at the same time more realistic and more to the point. So with myself, with Dr. Haifa, with Dr. Ihab, and the other professors and doctors, we hope we go through and take you through this experience to get the maximum in your interviews, and you'll be able to pass these interviews from your first attempt. Thank you very much, guys.
Thank you so much, Dr. Prof. Basim. And so sorry to take you from your patient in the clinic. Now I know you are busy now in the clinic. It will be an honor to work with you again. We have also from the faculty, Dr. Mahmoud Talat. I believe he had a problem with the connection, but now it's okay. Dr. Mahmoud? Okay, he did have a problem with connection. Dr. Mahmoud, can you hear us?
Yes, I can hear you, Dr. Ihab. Good afternoon,
Okay.
all. Dr. Ihab, good afternoon, my colleagues. Good afternoon, professors. Dr. Adil Mahjoub is here. He's my professor. Good afternoon, all candidates. In fact, because I have a poor connection here, so I will be precise. And as it is said, brevity is the soul of wit. So we will have many sessions later on, inshallah, and will be more specific in the subjects. But I have one sentence I want to say it and explain it. In this interview, the matter is not what you know. It is the matter of how you present it. To pass this exam, it is not the matter of what you know, it is the matter of how you present it. You are all potentially consultants. I'm talking, of course, to candidates. You are potentially consultants. You did a very good and a big effort to come here and to be this place. So I'm sure that the knowledge is almost present. But in each exam, not this one in particular, each exam, MRCS, exams, you should know what the examiner wants from you to let you pass. I think in this in Prep Medico and with these faculties, mostly all of us passed this exam. The foreigners doctors, we should pass this exam before practicing our job in Saudi Arabia. So, and some of us passed recently. The young doctors passed recently. Me, one of them. I did not pass. Less than 1 year. I passed my exam less than 1 year ago. So we are familiar, very familiar of what the examiners want and how we present it. In this course, we will do plus the knowledge through this experience. Dr. Haifa Al-Utaibi presented a very helpful and great presentation. We will continue over it and we will add some text and we will listen to your inquiries and questions and will answer you. And the most important thing, we will do a mocks, I mean, simulation of the presentation. You will practice and you will go through this exam before you go it, I think at least more than 10 times. So when you go to the exam, you will feel like you are in a training, you are in an interview like this. So we'll pass it very easily. And that's what happened to me, exactly. And I'm sure what happened to all of them who passed. I don't want to say too much because of poor connection and not to make you bore and to let my colleagues and friends present their ideas. Thank you very much.
Thanks so much, Dr. Mahmoud. Thank you so much for the feedback. Now we will show you our proposed schedule for the coming course. Dr. Haifa, kindly share the program. I believe it was told in brief by Mr. Mani and Dr. Faisal how it will be, how we will take you through the exam in a real life scenarios, in the real exam scenarios. So we'll prepare our program. Dr. Haifa, can you hear me? If you could just share the program.
I am prepared.
Yeah. Thank you so much. So this will be briefly our program for the coming course. As just mentioned by our colleague, it's all prepared and built on the how to prepare any candidate to pass exam in a very short time. So we started with something, we know that most of you will have the whole knowledge about how to present the data or the knowledge itself, but how to present it is the key component in this exam, as highlighted by my colleague. So the program will be like this. We will give a lecture, which is a review. We will not be able to give the whole knowledge about the situation, but we will just brainstorm with you how to train your mind to get the knowledge that you have in the background and present it. So we'll have a lecture first, which is in a review of the knowledge. We'll have a lecture for trauma, lecture for trauma and critical care, lecture for hepatobiliary, lecture for general surgery, colorectal lecture, breast, upper GI, endocrine, and after every lecture or review lecture, we will have the core of the course, which is the viva and the simulation of the exam. You will be one-to-one with the faculty. He will go through the whole candidate in the group, discussing one of the cases, taking every one of you in a real scenarios, which is we collected over the previous year. Surprisingly, you will find 80 or about 85% of the cases that you will face in the exam already discussed in our course. and it will be discussed in the same manner exactly as if you are in the exam, in the real situation. So the Viva session will have 6 Viva session for every category from the syllabus of the exam that you need to cover. So this is all about the course. We will start our course tomorrow, and we will be honored to serve all of you and help all of you to be ready for the exam. Now it's a time for the faculty to listen from your side. We need to know about you, about your expectation, about your preparation, and how we are going to help you in our course and your expectation from our course if you are going to join us. So anyone volunteer, it will be very good to listen from your side. What do you think about living in Saudi Arabia? What do you think about having the exam? Anyone?
Dr. Ihab, if you permit.
It's okay.
There is multiple options and can be tailored. For example, you can subscribe for the full course with 3 months of library. You can subscribe for training with 1 year of library. You can subscribe for specific topic. For example, you are interested by the hepatobiliary or colorectal, you can subscribe for just this specific session. For those who will pass the exam very soon, they can request mock viva, fast preparation with specific program, with faculty, with mock viva, with the feedback. So there is other options, and we are flexible to help you for any other thing that you want to do. And the floor is open for you for discussion. We will be very, very happy to listen your opinion, your suggestions. We are one family of doctors around the world, so
the all option that just mentioned by Dr. Faisal, it will be highlighted and explained well in the website. And LMS, we have an application for the course. But what I need now to hear from your side, I believe all of the attendees today is willing to have the exam. So one of the most critical point in the exam to be able to express yourself, to present yourself. We need to listen from your side.
Feel free to ask in any language.
Arabic, yes, ask in Arabic and French and could I ask طيب يعني دكتور أنيس دكتورة علا, tell us about your expectation.
Present yourself briefly. What is your purpose, your goals to work in Saudi Arabia, and what's your plan for the exam?
دكتور عاطف, دكتورة ليندا, دكتور محمد رضا. Okay, so يعني طب at least tell us what do you feel about what we just explained. دكتور محمد رضا, please.
السلام عليكم.
وعليكم السلام ورحمة الله وبركاته.
I am an Algerian surgeon with 12 years of experience. I have worked in Arabia Saudi 3 months, and I returned in Algeria. I don't pass the exam. I returned because there is a lot of stress and I have not the board. Donc, vous connaissez un peu les problèmes.
Mettez-vous à l'aise, sans aucun problème, بالعربية ولا بالانجليزية أنا بيناتنا.
دونك جي بريفيري هذه المره فضلت انه نعقب الامتحان، نجوز الامتحان قبل ما ندير مغامره اخرى. another experience. I try to speak in English to almost understand and I try to be more easily with English. Donc I will pass the exam in 2 months. perhaps. And I have just one suggestion, if you want. As in Algeria, we have a problem with the English language and English term technique, and I suggest that the Viva must be interactive, and we have to speak. We have to speak a lot of pour le jour de l'examen on soit plus à l'aise, c'est-à-dire يوم الامتحان نكونوا احسن مرتاحين احسن. Donc it's the most important problem that we have in the exam. Knowledge we know, term technique we can learn it in 2 months, 3 months, but speaking and have reflect response quickly, it's our problem actually. Thank you for
Thank you so much, Dr. Mahad. I'm sorry for you if you couldn't pass the exam previously, but I'm promising you we can help on this. And exactly this is what we are going to do, to make every one of you practice to be very comfortable when he attending the exam. And as Dr. Haifa said, and Dr. Basim and Mani and Faisal, it's not about the knowledge, it's about how to present yourself, how to be structured in your answer, how to present the consultant mindset. So our core focusing in this course is to do this. It's our core focusing in the Viva session. Viva session will be in an English. Every one of the attendees will go through in every Viva session not less than 3 or 4 cases. Across the course, he will listen actually to the other candidate, how they are going to go through the cases, and he will learn from others as well. All of the Viva session will be recorded on the LMS program in our application. So whenever you win, you need to go to it again at any time. You will be able to do this, plus the material that will be added to the LMS. So we know exactly how make anyone to pass the exam at very ease. So this is exactly what we are going to do in our course. Thank you, so Dr. Muhammad, and I'm wishing you will pass. 2 months is not so too much. It's extremely enough time to be ready to pass, inshallah, this time. If any one of the candidates or attendees have anything to say.
Thank you very much, Dr. Mohammed. En fait, c'est l'objectif majeur de la formation. This is the most important purpose of this training. As you said, English, it is for you. The knowledge, all of you that have knowledge. But the training, this is the purpose of our sessions. It's not about revision or theoretic. No, just simulation of exam each week. يعني you will have a group, your colleagues, and you will have expert faculty, station by station, as we have seen in the schedule. We will go through 8 to 10 to 12 clinical cases, try to cover all the program.
Okay.
As we say in French, training, question-réponse. Et l'objectif de s'entraîner pour le jour d'examen. L'objectif.
Okay, thank you. We have another question for Dr. Abdullah Mustafa. Dr. Abdullah, you want to say something? Okay, sorry for interruption, Dr. Faisal. You can continue.
So the most important thing is to be ready the day of the exam. The day when you'll be faced to the examiner, you will be comfortable. This stress is already managed. Yani through 7 weeks of hard preparation, this stress is mastered. The English, the medical English needed to answer is mastered. The knowledge, most important keywords, is mastered. So you will go through the exam comfortably. Inshallah, you will get your exam easy.
Okay, Dr. Abdullah, do you want to say something? Ask about anything, Dr. Abdullah Mustafa.
السلام عليكم.
عليكم السلام ورحمة الله وبركاته. عليكم السلام ورحمة الله وبركاته.
So my name is Abdullah Mustafa. I'm a surgeon here in UK. I have been in Saudi Arabia for almost 15 years, and I moved to UK. And it's my plan actually to go back to Saudi Arabia, inshallah, maybe by next year. I left Saudi Arabia as the senior registrar of general surgery, and I worked sometimes as a consultant. I didn't go for the exam. However, I'm planning now to go, inshallah, for the exam. I sat for the exam once last year, actually, to take it. However, my impression is the exam was very easy for me, but I was not well prepared. So the exam needs well preparation, not a lot of knowledge. It means, as Dr. Haita said, to test your safety, your competency, your team playing, and not only the knowledge. I only prepared for the exam for 1 week or 2 weeks. I depend actually on my good knowledge and guidelines in UK, which I'm doing it every day in daily practice, but this is not enough. So my advice is practice and the practice as well as good preparation. And if you do this with good knowledge, you will pass the exam. That's all what I want to say. Thank you.
Thank you.
Thank you so much, Dr. Abdullah. This is exactly what we are trying to elaborate. It's a very easy exam. It's a very stressful exam. All what you need to do just to practice and practice and practice and know the tips and tricks and the structure of the exam. So if anyone else wanted to add or ask about anything. Okay, I believe we come to the end of our session. If anyone of the faculty wanted to add anything. Okay, so thank you so much. Thank you for the attendees. Dr. Anis. Dr. Anis wanted to ask about. Go ahead, Dr. Anis.
Assalamu alaikum wa rahmatullah.
Alaikum salam wa rahmatullah wa barakatuh.
I wanted to present myself. Assalamu alaikum Sheikh Dor. نعرفه من زمان معرفة خير إيهاب. I am general surgeon in Algeria. I was in hepatobiliary center in Algiers, capital of Algeria, and I am GS consultant in Baha Hospital, Al Malik Fahd in Arabia Saudite since 4 months. So it's a pleasure to be among you, to follow your advices and your guidances to break all obstacles, inshallah. Barakallahu fikum wa rabbi azkum.
Did you book your exam?
No.
Not yet?
I will pass my exam in 3 months, inshallah, after giving all your experience.
Yeah, it doesn't need to stay for the whole 3 months. Inshallah, within 1.5 or after the course, you will be ready. But I'm a little bit worried how you are going to practice without license. You are telling me that you're a consultant in Baha, right?
Yes.
So be with us in the course. It will be ended within 6 weeks. Inshallah, you will be ready for the exam. And that's it. Okay.
Thank you so much.
So I believe we come to the conclusion of our session. As we started our session, we are all of the faculty, the pre-medical, the program, the material, the LMS. This session is created to help you to pass the exam, to be able to have a professional career life in Saudi Arabia. So whenever it comes to helping people, we will be there for you. Feel free to ask any question on the website. The whole logistic about to join the course will be very clearly announced. We'll start the course tomorrow, inshallah. And as Dr. Sheep elaborated, it's not about having this Viva session and the review lecture. You will have a library of material with the video record of all what's happening in the course. If you missed any of the session, you can go back to it at any time. We will have an open discussion on WhatsApp and Telegram group all the time, and the faculty will be tuned with you all the time to ask about anything or any scenarios. We have a lot of scenarios. We collected it in from the previous years, from the recalls. It's a real scenario from the exam. All of these collaborative things and material, it will be in your hand in a very easy and simple and friendly way. Thank you so much for joining us in this orientation session. Thank you, Dr. Faisal. Thank you, Dr. Basim. Thank you, Dr. Haifa. Thank you, Dr. Adil. Thank you so much, Manny. And thank you, thanks for the whole attendees and the whole candidate. Wishing you, inshallah, easy pass for the exam. Wishing you a great life in Gulf area and Saudi Arabia. Thank you so much. Bye-bye.